Hi, this is Dr. Debbie Hudak from All About Aesthetics, where we're all about you. I'm going to talk now on a Tech Tuesday about ultrasound, which is the mechanism of action of Ultherapy. First, you want to look as a quick reminder of what it is we're treating. We're treating age-related signs on the face and other parts of the body with regard to the skin and deep to the skin as well. Skin can be affected in the aging process by sun, by laxity in the skin, by gravity, and of course all of this is a function of time. With regard to Ultherapy, what we're doing is we're using ultrasound, which many of you may be familiar with. Is something that was used when you were pregnant or knew somebody was pregnant, and they were able to visualize the baby. In certain modes, it's exactly what ultrasound can do, is it can let us, almost like with X-ray eyes, see through the tissue that is on the surface deeper. Micro-focused ultrasound is what Ultherapy is all about. And that kind of technology is so powerful that it is used to break up kidney stones, and it's also used to break up gallstones. So when we are able to focus it where we want to focus it, we can have tremendous power to affect change. Specifically, if we first of all have the Ultherapy machine and its transducer in a position, and we can see where the dermis of the skin is, which is where collagen and elastin is made, where the subcutaneous layer of the skin is, which is where the fat lives, and deep to the skin layers, we have a layer of connective tissue that actually is referred to as SMAS, superficial muscular aponeurotic system, which is a condensation of coverings over whole muscles and muscle groups in the tissue. When we do a surgical facelift or a neck lift, we actually target this SMAS because we know if we find it and we either cut out a piece and then cinch together what's left or pleat it up, something like that, we can actually bring all of the underlying tissue of the muscle upward, lift it and attach it and anchor it. For instance, in the temple area or behind the ears for a neck lift. Ultherapy is the only device that is out there that the FDA has approved that is proven to actually allow us to do a non-surgical lift of the tissues as well as tightening of the skin by using micro-focused ultrasound at the layer of the SMAS as well as at the layer of the skin and the dermis to reduce fat by micro-focusing our energy in the subcutaneous layer where the fat lives. This is a little overview. We can see here skin with dermis, subcutaneous layer where the fat lives, connective tissue of where the SMAS is, and deep to that, the muscle. Again, this is just an overview. This is telling us basically we can treat anything, whether it is the face, lifting up brows, lifting up necks, lifting up lower face, just about anything you want, if the person behind the machine knows what needs to be targeted and can analyze where you want most for energy to be or not be, you can get wonderful creating of a youthful face, once again using Ultherapy. With the Ultherapy, and this, by the way, is somebody after their first set of treatments on the neck and after the second, tremendous change we can see over time. And here we can see what we actually see with the Ultherapy, where one can delineate where the dermis is and the subcutaneous layer and the SMAS level. Again, this depends on the person behind the transducer, the person using the machine, being able to identify properly the tissue that needs to be targeted, making sure there's proper contact with it, that it's not that the transducer is properly 90 degrees to exactly where you want it to treat so that you get optimal results. And this here is showing various different depths that we go to in our various treatment modalities, whether we're going again into the dermis, the subcutaneous layer, or into the SMAS. Again, energy into the dermis will cause collagen if it's at the right temperature, the optimal temperature being about 70 degrees centigrade, which is exactly what Ultherapy does, is it gets it in that 68 to 70 degrees Celsius temperature, so that whatever collagen has become lax becomes more tightly coiled. Also, the energy going into that level will trigger a whole new round of collagen and elastin formation at a rate that is faster than what you would normally produce, whatever your given age. If we direct that energy into the subcutaneous layer, we're going to literally shatter some of the fat cells, and you're going to be able to reduce fat in areas. And if you direct the energy into the SMAS, you're going to actually get a lifting of tissue as it shrink wraps the tissue in a way that simulates what I would get if I was surgically going in and pulling together and cinching up the SMAS. Phenomenal technology for phenomenal results. Anyway, I would like to say, if you have any other questions, please feel free to come by, get a consult with Tanya, Nija, or myself, Dr. Hudak, at All About Aesthetics, where we're all about you. Have a great day.